Gentleman from New York has 41 minutes remaining.
Thank you. I yield 5 minutes to the gentleman from Vermont, Mr. Sanders.
Mr. Speaker, when we look at the health care crisis in America, there are many dimensions to it. But clearly, one of the dimensions is that in my state of Vermont and all over this country, physicians are writing out prescriptions to their patients, but you know what they're saying? They're saying, what is the sense of me writing out a prescription if my patient can't afford to get it filled? So what we are finding is that senior citizens and many, many other people are simply unable to take the prescription drugs that they need, or they're dividing their dosages in half, or they're taking their prescription drug once every other day. We hear from pharmacists, and our legislation is supported by the Community Pharmacists of America. They stand behind their desks, behind their counters, and their hearts are broken when senior citizens cannot afford the products that their doctors are prescribing, when people are dying and when people are suffering, and we have the cure right in front of us. So some of us in this Congress, well over a year ago, Marion Barry, who was right here, Joanne Emerson of Missouri, and I introduced legislation which was a very, very simple piece of legislation. What we said is that we are living in an increasingly globalized economy. And I must tell you, I have many problems with the globalized economy. But we're living in that economy. And if you go to a shoe store, the shoe company is able to purchase shoes any place in the world. If you go to a pants store, a haberdashery, they purchase their products any place in the world. So we are asking a very simple question. If a prescription drug is FDA safety approved, why can't a prescription drug distributor or a pharmacist purchase that product any place in the world at a significantly lower price than the pharmaceutical industry is selling it to him in the United States right now? Why can't competition exist, free market exist, global economy exist when you're talking about prescription drugs which are FDA safety approved? Now, if that legislation were passed today, what you would have is prescription drug distributors testing the market in Canada. They would buy tamoxifen for 1/10 the price. They would buy other drugs for 50% the price. They'd be able to resell it to American consumers for significantly lower prices than we are currently paying. Now, what's wrong with that legislation? Nothing is wrong with that legislation. What that legislation would do is lower prescription drug costs in this country from between 30 to 50% at almost zero expense to the American taxpayer. It would allow American business people who import drugs to take advantage of the best prices that are available all over the world. Now, our friends in the pharmaceutical industry, who last year made $27 billion in profit, our friends in the pharmaceutical industry who are contributing millions and millions of dollars to both political parties, our friends in the pharmaceutical industry who, if you can believe it, have 300 paid lobbyists here in Washington, D.C., our friends in the pharmaceutical industry who spent $65 million in advertising last year trying to defeat any legislation that would lower the cost of prescription drugs, well, let me tell you, they are fighting back vigorously. They are putting on dishonest, misleading ads on radio, TV, and in the newspapers, and they are saying that members of Congress, oh, we want to import unsafe, adulterated drugs. What a horrible, terrible thing to say about members of Congress who are fighting so that their constituents can afford the prescription drugs that they need. What a disgraceful thing to say about members of Congress, that we would want to see an unhealthy prescription drug come into this country. It is simply untrue. The legislation that passed in the Senate is very clear. There are strong safety conditions attached to it. The FDA has said that if they have $23 million to increase their capabilities, they will guarantee that the products coming into this country are safe. This is not rocket science. It is easily done. The problem is not unsafe drugs that will come in if our legislation is passed. The problem is that today Americans are dying, Americans are suffering because they cannot afford the outrageously high cost of prescription drugs. That's the problem. And the pharmaceutical industry, which is every day showing the American people how outrageously greedy they are. Apparently $27 billion in profits last year is not enough. I guess they need more than that. Apparently charging Americans 10 times more than Canadians for certain drugs is not high enough prices. They need more than that. Well, all over this country, the American people are saying enough is enough. Let's lower the cost of prescription drugs. Let's not continue the ripoff of the American people so that our people are paying so much more than the people in Europe, the people in Mexico, the people in Canada. And that's what this legislation is about. Don't believe the dishonest ads that the pharmaceutical industry is publishing. As I mentioned a moment ago, over a year ago, legislation introduced by Marion Berry of Arkansas, Joanne Emerson and myself, set the groundwork, started the process for this, and we are making real progress. If that legislation were put on the floor today, we'd have overwhelming bipartisan support. I challenge the Republican leadership to show the American people that they have the guts to stand up to the pharmaceutical industry, that they will allow the House and the Senate to vote on this legislation. If they allow us to do it, it will win. We will lower prescription drug prices in this country, and we will have done something that the American people will be very proud of us for doing. And I would yield back to my friend.
I thank the gentleman from Vermont. And